In this video, we're going to look at some thoracic, that middle and upper back mobility techniques to improve range of motion and decrease pain. Our first movement is just going to be a seated cat-cow movement. Now you can do this on your hands and knees, but for a lot of patients, if it's difficult to get in that position, they're having pain, it may be easier to do this in a seated position. So what you're going to do is just sit in a chair. I typically have my patients put their hands in their lap here or down by their side. It doesn't really matter. And you're going to work on rounding the shoulders and the upper back kind of over and forwards, and that's going to be that cat position. So you're rounding over as far as you can. And then you're going to go all the way back, kind of poke your chest out, bring your shoulders back, increase that arch or that sway in the lumbar spine, that low back area, go back into the cow position, and then move back into the cat position. And just repeat that back and forth, typically somewhere around 1 to 2 sets of 10 to 15 repetitions, and that's something that you can do just throughout the day. A lot of you may be familiar with that thread the needle movement where you're kind of on your hands and knees and you're going underneath. Again, that may be difficult for some patients to get in that position. So I like to use a tabletop or a countertop, and you're going to use a pillowcase. So what you're going to do is we're going to start off with my left hand forwards. My right hand is going to be on the pillowcase because it slides pretty easily. You don't have to use a pillowcase. You can just reach, but I just like to use the pillowcase because it just seems to work a little better. You're going to rotate or kind of go in, reaching as far as I can over to my left, and then I'm going to come back across all the way, reach all the way back in as far as I can, and then I repeat that to the opposite side. So then my right hand would come forwards and my left hand would go underneath, and I would rotate as far as I could to my right side. I'd complete that for 1 to 2 sets of around 10 to 15 repetitions. A lot of people lie on their backs and use foam rollers going into extension. I do have videos where I am going into extension, lying on my back using a foam roller, but for some people that may be too uncomfortable. They may have some issues where medically where they're not able to get in that position. So you can take the foam roller, go over to the wall, find a nice stable spot on the wall to put the foam roller, kind of get it in there in that lower middle to lower thoracic spine area. You can really put it wherever, just kind of work it all over. I'm just going to lean back over the foam roller, kind of looking up at the ceiling, and then come back to midline, go back over again, leaning back over, come back to midline. And you can kind of play with that. You can adjust the foam roller kind of up and down the spine just to work various segments going into the extension. Repeat that for 1 to 2 sets of around 10 to 15 repetitions. Using the same foam roller, you're going to take it, put it on a stable surface, maybe a tabletop again, or maybe the top of your bed. And what you're going to do is put both arms, both forearms are going to rest on it, and I'm going to reach forwards as far as I can. And as I reach forwards, I'm kind of letting my back kind of go into extension. So when I go down, I'm just going into a little bit of extension in that middle back area there, and then come back up. I'm going to go back forwards again, really go into that extension. I'm going to try to look up also if I can when I do that movement, and repeat that for 1 set to 2 sets of 10 to 15 repetitions. Using a pillowcase or a towel, this is a great way to really work on stretching the upper back area. So what you're going to do is wrap this around a stable surface, and this can be a lower surface, can be a higher surface, just kind of whatever you have access to. And what you're going to do is straighten out your arms and really lean back, and as I lean back, can really feel that stretching in my lat muscles, all the muscles in the middle and upper back, even the backs of my shoulders, just really stretching, leaning and holding that. I'm going to come back and relax, go back in again. You're going to want to hold this stretch for around 10 to 20 seconds and repeat that for a couple of repetitions just throughout the day. These are going to be doorway stretches. You can also do these in a corner. So what you're going to do is just take your hands wherever it feels comfortable and lean in. You're going to feel that stretch come across the front part of your chest, across the front part of your shoulders. I'm leaning in, and as I lean in, I'm almost kind of extending my thoracic spine, really trying to open up the chest area. I may even have my patients look up a little bit with the cervical spine with that. Hold that for around 10 to 20 seconds. Repeat that for a couple of repetitions just throughout the day. This is going to be a seated rotation stretch. So what you're going to do is reach across, grab a chair that has an armrest on it, reach across, I'm turning to the left, I'm also pulling myself to the left using my right hand. I'm going to hold that between 10 to 20 seconds. Then I'm going to repeat that to the other side. I'm going to pull myself around to the right, far as I can, holding that for 10 to 20 seconds. And I repeat that for a couple of repetitions several times a day. Now that we've worked on the mobility exercises and kind of stretches to open up the thoracic spine, I want to do a couple of techniques to try to kind of keep that movement. So what you're going to do is take one of these exercise bands, wrap it around the surface that's stable, and then you're going to work on just pulling back, pulling your arms back, almost like you're rowing a boat. You're going to do that, and while you're doing it, you're going to squeeze your shoulder blades together. And you can do that for around 2 to 3 sets of 10 to 15 repetitions, 1 time a day. Now I'm going to take that same band and I'm going to hold it out in front. You want to use a band that's light enough to where you can perform the movement, but that's eventually you're going to progress to a more resistive band, and you're going to pull this apart. While you pull it apart, you're going to squeeze your shoulder blades together. So really squeeze your shoulder blades together and come back to midline. Pull that apart again, squeeze your shoulder blades together, come back to midline. Perform that for 2 to 3 sets of 10 to 15 repetitions, 1 time a day. Thanks so much for watching. I hope this video helps with your thoracic mobility and pain that you may be having. Be sure to hit that follow button so you stay up to date on all my content. Thanks again.